When assessing the abdomen, the correct order is A. Inspection, auscultation, percussion, palpation. B. Palpation, auscultation, inspection, percussion. C. Auscultation, inspection, palpation, percussion. D. Percussion, palpation, inspection, auscultation. Correct answer is A. Inspection, auscultation, percussion, palpation. The abdomen is assessed differently from other body systems. Inspection is done first to observe contour, symmetry, and skin changes. Auscultation comes next because touching the abdomen can stimulate bowel activity and alter bowel sounds. Percussion and palpation are done last to avoid creating false or increased bowel sounds. Which system is evaluated when listening to bowel sounds? A. Respiratory. B. Cardiovascular. C. Gastrointestinal. D. Nervous. Correct answer is C. Gastrointestinal. Bowel sounds are caused by peristalsis, the movement of food and gas through the intestines. Since the intestines belong to the gastrointestinal system, bowel sounds assess gastrointestinal function. The respiratory system produces breath sounds, the cardiovascular system produces heart sounds, and the nervous system controls signals. Which cranial nerve is tested by asking the patient to shrug shoulders? A. Cranial nerve 5, B. Cranial nerve 7, C. Cranial nerve 11, D. Cranial nerve 3. Correct answer is C. Cranial nerve 11. Cranial nerve 11, spinal accessory, nerve, controls the trapezius muscle, which allows shoulder shrugging. Cranial nerve 5 controls chewing and facial sensation. Cranial nerve 7 controls facial expressions, and cranial nerve 3 controls eye movement and pupil response. Inspection of the skin includes checking for A. Bruits, B. Skin breakdown and lesions, C. Heart murmurs, D. Pedal pulses. Correct answer is B. Skin breakdown and lesions. Inspection means using the eyes only. Skin breakdown, wounds, rashes, and lesions can be visually observed. Bruits and heart murmurs require auscultation with a stethoscope, while pedal pulses require palpation. You cannot see sounds or feel pulses during inspection. Which pulse is assessed on the top of the foot? A. Brachial, B. Carotid, C. Dorsalis pedis, or D. Popliteal. The correct answer is C. Dorsalis pedis. The dorsalis pedis pulse is located on the top of the foot and is used to assess circulation to the lower extremities. The brachial is in the arm, the carotid is in the neck, and the popliteal is behind the knee. Inspection of the mouth includes looking at A. Palate, gums, mucosa, B. Pedal edema, C. Capillary refill, or D. Jugular vein distension. The correct answer is A. Palate, gums, mucosa. During mouth inspection, the nurse visually examines the palate, gums, tongue, and oral mucosa for color, lesions, and moisture. Pedal edema affects the feet, capillary refill is checked at the nails, and jugular vein distension is assessed in the neck. When palpating lymph nodes, normal nodes are A. Hard, fixed, non-tender, B. Soft, movable, non-tender, C. Warm and painful, or D. Absent. The correct answer is B. Soft, movable, non-tender. Normal nodes are typically soft, movable, and non-tender. Hard and fixed nodes may indicate malignancy, while warm and painful nodes suggest infection. Although normal nodes may be difficult to feel, they are still anatomically present. A common method for checking cranial nerves during assessment is A. Reflex hammer, B. Stethoscope, C. Ophthalmoscope and penlight, or D. Goniometer. The correct answer is C. Ophthalmoscope and penlight. An ophthalmoscope and penlight are commonly used to assess cranial nerves, especially cranial nerve 2 and cranial nerve 3, by checking vision and pupil reaction to light. A reflex hammer tests spinal reflexes, a stethoscope listens to body sounds, and a goniometer measures joint movement. Which area is assessed with auscultation? A. Abdomen, B. Eyes, C. Lymph nodes, or D. Feet? The correct answer is A. Abdomen. Auscultation means listening with a stethoscope. The abdomen is auscultated to hear bowel sounds. The eyes are assessed by inspection, while lymph nodes and feet are assessed mainly by palpation to feel for size, tenderness, pulses, or swelling. The purpose of measuring oxygen saturation, SpO2, is to assess A. Digestive function, B. Neurological reflexes, C. Tissue oxygenation, D. Pain levels. Correct answer, C. Tissue oxygenation. Oxygen saturation, SpO2, measures the percentage of oxygen-carrying hemoglobin in the blood, which reflects how well oxygen is being delivered to the body's tissues. It does not assess digestion, neurological reflexes, or pain. Inspection of nails should include checking for A. Murmurs, B. Clubbing and color, C. Lung sounds, D. Pupillary response. Correct answer, B. Clubbing and color. The nails reflect oxygenation and circulation. Clubbing, rounding of the nails, can indicate chronic low oxygen levels, while nail color helps assess blood flow and oxygen status. Murmurs and lung sounds are assessed by auscultation with a stethoscope, and pupillary response is assessed in the eyes. Which finding is abnormal during a head-to-toe assessment? A. Clear lung sounds, B. Symmetrical chest expansion, C. Jugular venous distension, D. Equal radial pulses. Correct answer, C. Jugular venous distension. Jugular venous distension is an abnormal finding and may indicate heart failure or fluid overload. Clear lung sounds, symmetrical chest expansion, and equal radial pulses are normal findings in a healthy patient. Assessment of the neck includes examination of A. Thyroid gland, B. Heart valves, C. Hepatic span, D. Dorsalis pedis pulse. Correct answer, A. Thyroid gland. The thyroid gland is located in the anterior neck and is assessed during neck examination. Heart valves are assessed in the chest, hepatic span refers to the liver in the abdomen, and the dorsalis pedis pulse is assessed in the foot. Auscultating heart sounds helps assess A. Brain reflexes, B. Cardiac function, C. Gastrointestinal motility, D. Peripheral pulses. Correct answer, B. Cardiac function. Auscultation of the heart evaluates cardiac function by assessing heart rate, rhythm, and valve closure sounds. It does not assess brain reflexes, gastrointestinal motility, or peripheral pulses. Which part of assessment checks cranial nerve 8? A. Hearing assessment, B. Pulse check, C. Blood pressure, D. Reflex testing. Correct answer A. Hearing assessment. Cranial nerve 8, vestibulocochlear nerve, is responsible for hearing and balance. Hearing tests assess this nerve. Pulse checks and blood pressure assess the cardiovascular system, while reflex testing mainly evaluates spinal nerves. A doppler may be used when A. Assessing cranial nerves, B. When pulses are difficult to palpate, C. Testing reflexes, D. Taking blood pressure only. Correct answer B. When pulses are difficult to palpate. A doppler uses ultrasound to detect blood flow. When a pulse cannot be felt due to poor circulation, swelling, or obesity, a doppler is used to hear the pulse. It is not used for cranial nerve testing or reflexes. Although it can assist with blood pressure in special situations, its primary use is locating difficult-to-palpate pulses. Which part of the head-to-toe assessment should be performed first? A. General appearance, B. Vital signs, C. Neurological status, D. Pain assessment. Correct answer A. General appearance. Assessment always begins with the general survey, which includes observing the patient's appearance, posture, level of distress, and hygiene. This observation starts immediately upon seeing the patient. Vital signs, neurological checks, and pain assessment follow after the initial visual assessment. During assessment of level of consciousness, which scale is most commonly used? A. Wong-Bakker scale, B. Glasgow-Coma scale, C. Braden scale, D. Morse scale. Correct answer B. Glasgow-Coma scale. The Glasgow-Coma scale is the standard tool used to assess level of consciousness. It evaluates eye opening, verbal response, and motor response. The Wong-Bakker scale measures pain, the Braden scale assesses pressure injury risk, and the Morse scale evaluates fall risk. Which cranial nerve is assessed by asking the patient to read an eye chart? A. Cranial nerve 1, B. Cranial nerve 2, C. Cranial nerve 3, D. Cranial nerve 5. Correct answer B. Cranial nerve 2. Reading an eye chart casts visual acuity, which is controlled by cranial nerve 2, optic nerve. Cranial nerve 1 is responsible for smell, cranial nerve 3 controls eye movement and pupil response, and cranial nerve 5 controls facial sensation and chewing. Which finding during pupil assessment is considered normal? A. Unequal pupils, B. Fixed pupils, C. Sluggish reaction, D. Pupils equal and reactive to light. Correct answer D. Pupils equal and reactive to light. Normal pupils are equal in size and react promptly to light, indicating normal brainstem and cranial nerve function. Unequal, fixed, or sluggish pupils are abnormal findings and may indicate neurological impairment. Which lymph nodes are palpated along the sternocleidomastoid muscle? A. Submental, B. Submandibular, C. Cervical, D. Occipital. Correct answer C. Cervical. The cervical lymph nodes run along the sternocleidomastoid muscle in the neck and are routinely palpated during head and neck assessment. Submental nodes are under the chin, submandibular nodes are under the jaw, and occipital nodes are located at the base of the skull. The best position to assess jugular venous distension is A. Supine, B. Prone, C. Sitting upright, D. Semi-Fowlers at 45 degrees. Correct answer D. Semi-Fowlers at 45 degrees. Jugular venous distension is best assessed with the patient in semi-Fowler's position at about 45 degrees. This angle allows gravity to reveal the height of venous pressure. When supine, the veins appear falsely full. When fully upright, the veins may collapse and be difficult to see. Which abdominal assessment technique should be performed last? A. Inspection, B. Auscultation, C. Palpation, D. Percussion. Correct answer C. Palpation. In abdominal assessment, palpation is performed last because pressing on the abdomen can cause discomfort and stimulate bowel activity, altering bowel sounds. Inspection is done first, followed by auscultation, then percussion, and finally palpation. Which organ is palpated in the right upper quadrant? A. Spleen, B. Liver, C. Stomach, D. Bladder. Correct answer B. Liver. The liver is located in the right upper quadrant and may be palpated during abdominal assessment. The spleen and stomach are in the left upper quadrant, while the bladder is located in the lower midline abdomen. Which finding indicates pitting edema? A. Skin redness, B. Skin warmth, C. Indentation remains after pressure, D. Dry skin. Correct answer is C. Indentation remains after pressure. Pitting edema is identified when pressure applied to swollen tissue leaves an indentation that persists after release. This occurs due to excess fluid in the interstitial spaces. Redness, warmth, and dry skin do not define pitting edema. Which pulse is assessed during a routine adult head-to-toe exam? A. Carotid only, B. Apical only, C. Temporal only, D. Radial. Correct answer is D. Radial. In a routine assessment of a stable adult, the radial pulse at the wrist is the standard site used to assess heart rate and rhythm. The carotid pulse is usually reserved for emergencies. The apical pulse is used when more precise cardiac monitoring is needed, and the temporal pulse is rarely used in routine adult assessments. Which assessment checks cerebellar function? A. Pupillary reaction. B. Finger-to-nose test. C. Babinski reflex. D. Light touch. Correct answer is B. Finger-to-nose test. The cerebellum controls coordination and balance. The finger-to-nose test evaluates coordination and accuracy of movement. Pupillary reaction assesses cranial nerve 3. The Babinski reflex assesses motor pathway integrity, and light touch assesses sensory function. Head circumference in infants is measured to assess A. Brain growth, B. Vision, C. Hearing, D. Nutrition. Correct answer is A. Brain growth. In infants, the skull bones are not fully fused, so head circumference reflects brain growth and development. Abnormal measurements may indicate neurological conditions such as hydrocephalus or microcephaly. It does not directly assess vision, hearing, or nutrition. The APGAR score is assessed at A. 30 seconds and 1 minute, B. 1 and 5 minutes, C. 5 and 10 minutes, D. 10 and 15 minutes. Correct answer is B. 1 and 5 minutes. The APGAR score is routinely measured at 1 minute and 5 minutes after birth to evaluate a newborn's immediate adaptation to life outside the womb. The 1-minute score assesses initial status, while the 5-minute score evaluates ongoing adaptation. Other time intervals are not standard. Which skin finding in a newborn is normal? A. Cyanosis, B. Petechiae, C. Milia, D. Jaundice at birth. Correct answer C. Milia. Milia are tiny white bumps commonly seen on a newborn's face and are normal and harmless. Cyanosis and petechiae are abnormal findings that require evaluation. Jaundice present at birth is abnormal. Physiological jaundice normally appears after 24 hours. The best way to assess pain in a toddler is by A. Numeric pain scale, B. Behavioral cues, C. Verbal description, D. Visual analog scale. Correct answer B. Behavioral cues. Toddlers, about 1 to 3 years old, cannot reliably use numeric or abstract pain scales. Nurses assess pain by observing behavioral cues such as facial expression, crying, body movement, and consolability. Tools like the FLAC scale are designed specifically for this age group. Which assessment is most important during a pediatric respiratory exam? A. Blood pressure, B. Work of breathing, C. Heart sounds, D. Bowel sounds. Correct answer B. Work of breathing. In children, respiratory deterioration can occur rapidly. Work of breathing, including nasal flaring, grunting, retractions, and use of accessory muscles, is the earliest and most sensitive sign of respiratory distress. Blood pressure changes occur late, and heart or bowel sounds do not directly reflect respiratory effort. When assessing gait, the nurse is primarily evaluating A. Sensory function, B. Cranial nerves, C. Musculoskeletal and neurological function, D. Cardiovascular function. Correct answer C. Musculoskeletal and neurological function. Gait requires muscle strength, joint movement, balance, and coordination, which involve both the musculoskeletal and neurological systems. Sensory input plays a role, but gait is not primarily a cranial nerve or cardiovascular assessment. Which finding indicates dehydration in infants? A. Bulging fontanelle, B. Normal skin turgor, C. Increased urine output, D. Sunken fontanelle. Correct answer D. Sunken fontanelle. A sunken fontanelle is a classic sign of dehydration in infants. Because the skull bones are not fused, fluid volume changes are reflected in the fontanelle. A bulging fontanelle suggests increased intracranial pressure, while normal skin turgor and increased urine output indicate adequate hydration. Which assessment is priority in an unconscious patient? A. Pain, B. Airway, C. Nutrition, D. Mobility. Correct answer B. Airway. Assessment priorities follow the ABC approach: airway, breathing, circulation. An unconscious patient may be unable to protect their airway, making airway assessment the highest priority. Pain, nutrition, and mobility are important, but secondary to immediate survival needs. The best position to assess lung sounds posteriorly is A. Supine, B. Prone, C. Side-lying, D. Sitting upright. Correct answer, D. Sitting upright. Sitting upright allows for maximum lung expansion and gives the nurse full access to the posterior lung fields where the lower lobes are best auscultated. Supine, prone, and side-lying positions limit expansion and can muffle lung sounds. Which assessment checks tactile sensation? A. Vibration, B. Light touch, C. Position sense, D. Reflexes. Correct answer, B. Light touch. Tactile sensation refers to the sense of touch. Light touch testing, often done with a cotton wisp, evaluates this sensory pathway. Vibration tests deep sensation, position sense assesses proprioception, and reflexes evaluate motor response, not sensation. Which assessment technique is used to check for fluid in the lungs? A. Palpation, B. Percussion, C. Auscultation, D. Inspection. Correct answer, C. Auscultation. Auscultation is used to listen to lung sounds and can detect abnormal sounds such as crackles or rails, which indicate fluid in the lungs. Palpation checks for masses or tenderness, percussion helps assess underlying structures, and inspection observes breathing effort and symmetry. Which finding is abnormal in a newborn? A. Irregular respirations, B. Acrocyanosis, C. Startle reflex, D. Persistent central cyanosis. Correct answer, D. Persistent central cyanosis, blue discoloration of the lips, tongue, and trunk, indicates inadequate oxygenation and is an abnormal and dangerous finding. Irregular respirations, acrocyanosis, blue hands and feet, and the startle reflex are normal findings in newborns. PERLA stands for pupils A. Equal, round, reactive to light and accommodation, B. Equal, random, reactive, large, absent, C. Pupils equal, responsive, reactive, light, absent, D. Pupils equal, round, reactive, laterally advantaged. Correct answer, A. Equal, round, reactive to light and accommodation. PERLA is the standard acronym used to document a normal pupil assessment. It indicates that the pupils are equal in size, round in shape, and react appropriately to light and accommodation. How many questions did you get correctly? Drop your score in the comments section and subscribe for more nursing and NCLEX questions.